outside and people are so energized.
I hear Mary's voice.
Good morning. Good morning. Thank you for coming. I'm glad you're all wide awake out there. It's wonderful. I'd like to start with the Pledge of Allegiance. Beth, would you please lead us?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. And I want everyone to welcome our new person joining our group, which is Sandy Cece. She is the new Karen. So hopefully she's the new Karen that stays a long time now. So we're going to try and go nice and calm so that she can keep up. Usually Sandy, I always do the pledge first. That's just what I like to do. So can we have roll call, please?
Gould. Dollinger. Here. Berry.
Here.
Militello. Here. Rice. Here. Summers. Here.
Here. Thank you. First thing on our agenda today is the meeting minutes from the August 2nd meeting. Do I have a motion to approve?
Motion.
Second.
Motion by Ferry, second by Beth. Any changes? Nope. Everybody in favor?
Aye.
Aye. Thank you. Okay, we have miscellaneous reports today. We have our Board of Health minutes from 6/20 and our Sunny Hill Nursing Home updates from July 2018. So you have those available for you. Next, we have our old business, which is Dr. Kathleen Burke. She's going to give us an update on our opioids.
Good morning.
Good morning.
I have a few things I'm going to pass around. So this is the new brochure that the state has put together, and it has a description of what to do for an opioid overdose, how to identify it. It's a really good brochure, so I got quite a bit of it I'm going to pass out to the community, but I thought I would start with you guys.
Great, thank you.
And then I brought copies of my report because yesterday when they were talking about dates and statistics and things, it's much easier to because this is a bigger report than normal. Judy asked me to talk about the legislation, but this is the end of my fiscal year for my grant, so I included some information about my grant. And I think if we go to the let's wait till it goes around. The one sad note that I'd like to let people know about is Dan Biggs was the co-founder and executive director of the Chicago Recovery Alliance, and Dan is a colleague of mine. He has a PDO grant like mine, and we've been working together over the last couple of years. He passed away over a week ago suddenly, 59 years old, and he passed away in his sleep. So it's hitting the organization hard, and it's hitting all of us hard because we consider him the founder of naloxone. He really advocated for us to be able to give naloxone out in the community. The Chicago Recovery Alliance does needles exchanges, so that's how their organization was able to be a front runner on that, and they still do give out needles as opposed to the sprays that I give out, but that's going to be a tremendous loss to our community.
Yeah, definitely. When you lose that type of leadership.
Absolutely. So if we could go to the last page of my report, what this is indicating is how many people that I've trained and how many of those people, how many organizations that they represented. And it's in comparison to all of the people who have a grant similar to mine. There are two different types of grants. I have one that's called a PDO, and then there is an STR. I'm not going to give you the long names because it's irrelevant, but the STR grants do a little bit more, and it comes out of a different pot of money. The PDO folks are all about just naloxone training. And I'd also like to point out that the PDO folks that I work with I am the only one who is in one person. Most of them are health departments, and so they have staff assigned to it that they already employed, and so they have multiple hands on deck. So I'm very proud of the 793 people that I trained just for 1 year. We trained many, many more. But for last year, we've trained 793 people how to use Narcan. You're probably going to hear on the news, I was training people at the overdose awareness program in Atlantic last week, and one of the individuals I trained saved someone in Pitt Park here in Joliet, and we put a press release out on it, and I guess it made WBBM News this morning. So that's putting things to work right away.
Just-in-time training, right?
Yes, it is, absolutely. Any questions about that? Okay. So the legislation, which is starts on page 3. The legislation, actually, there's been quite a bit going on. And I'm pleased to say that it's significant for the work that I do. The first one is the Public Act 100-0564. And that mandates that prescribers with controlled substances licenses register with the Illinois PMP, and that they document an attempt to check the Illinois PMP when providing an initial prescription to opioids. I'd just like to remind everybody that the source of the opioid epidemic has been identified as the overprescribing of prescription pain medication, that the statistics validate that most people who are using heroin had also had a prescription to prescription pain pills. So the strategies that were used in Illinois was to identify those physicians who were overprescribing, not necessarily from a punitive standpoint, but also from an educational standpoint, because it is a different type of practice. And so the Illinois Prescription Management, the PMP, is required because of Illinois state law. Before it was, you could or you couldn't, now it's required. So that's huge, and so we've seen a big uptick in people registering and getting the information online for people. What that allows is other doctors or pharmacists to go on and to make sure that when they're prescribing a medication, it hasn't already been prescribed by another doctor in the same way. So it prevents the prescription shopping, but it also identifies any doctor who may be prescribing more than usual, more than the average doctor, so it ends up being a hit. That can happen because they're a pain doctor, but it's worth looking at just to make sure that there's nothing else going on. Any questions? The next bill is Senate Bill 1707, and that improves the insurance company's coverage of mental health and substance use disorder treatments and strengthens the ability of the Department of Insurance to protect consumers. The lack of parity and the lack of coverage has been exasperating the opioid epidemic, and it's come to the attention. And as you can see, our legislators did something about it. It's going to stop the loopholes that our insurance companies find not to provide that type of care across the board, not just Medicaid, Medicare, but also private insurance companies. Another one that supports access is Senate Bill 682, and that allows providers to give immediate access to outpatient treatment by removing prior authorization barriers. We had some insurance companies, including a Medicaid HMO, that required 48 hours prior notice. Well, when someone overdoses and they're in the emergency room, 48-hour prior notice means that they have to go back out on the street and will probably use again because they're in withdrawal and may die. And it was a inappropriate type of regulation that was costing people lives, so they changed that. They can't do that anymore.
I remember you really stressing that throughout, that there was a critical issue that we had, that people were being released and then they'd go back out and OD again before they would even have any treatment.
Exactly. The warm handoff, which we have that program at Silver Cross now, you do not want someone who has an overdose leaving that emergency room without their connecting to treatment. Whether it be inpatient or outpatient, they need that connection right away. The next bill is Senate Bill 3049, which provides access to behavioral and mental health experts for Medicaid patients by allowing them to utilize telehealth technology. This is a big one also because there's a shortage of psychiatrists and treatment providers, particularly down south and areas that are rural that do not have many providers. And I would also say for us, because part of our community in Will County is rural and does not have access to providers nearby. And so this identifies it right up front that telehealth is going to be reimbursed, and that's a positive for us, so that's pretty good. The next bill is Senate Bill 3023, partners law enforcement agencies with licensed substance abuse service providers. That helps me with my Safe Passage program, because one of the challenges that we've had with Safe Passage is linking people once they identify that they want help to a treatment service immediately. This law is supposed to allow the police departments to make those kind of connections because they don't normally create linkage agreements with the treatment folks. We're already doing that with Family Guidance Inc. They have taken on our Safe Passage program and are going to be developing linkage agreements with all of our police departments if they so choose. We've already done it with Lockport and Lamont. And I believe one of our newest folks to become Safe Passage is the Sheriff's Office, and they've talked to the Family Guidance Center too. So that's going to facilitate like a one-stop shop. And Family Guidance will not just be referring people to their own services, but they will be referring people to all services depending on what that client wants. What the advantage of Family Guidance Inc., which is a methadone provider across the state, who also provides Vivitrol and therapy, and has 3 hospitals in the city and 1 in Springfield that they support for treatment. What that is modeling what the state calls a hub and spoke model, where you have one person who's able to then send out the needs for resources to all these people. The state is requiring in some of its pilots that a hub be a methadone provider, because you have to have a medical MAT provider be that. So we are very lucky that Family Guidance came to our community. Actually, the executive director lives in Joliet, so that helps a lot. Ron is a friend and a colleague of mine, and so we're going to be expanding that. And I can tell you the police departments are very happy that this is working out this way, because they were in a real jam trying to get people placed. I mean, if social workers can't get people placed, police departments weren't getting people placed. So, okay. The next bill is Senate Bill 2951, which provides the Department of Health Care and Family Services the opportunity to apply a waiver that would allow treatment for serious mental illness on a first episode of psychosis. What that means is you no longer have to start at the minimal amount of care. In acute care for a medical illness, you usually do not want to throw the most involved, the most expensive treatment at someone. You usually start at a lower form of care. So you don't tell someone that, well, you shouldn't tell someone they need an Oxycontin when they could take a Advil. Or you don't need heart surgery before you are put on a blood pressure pill or something like that. In mental health and substance use, it's the reverse. You want to put people on the most intensive care right away, because that has it's required for the intensity of the individual, and it has an immediate impact. Whereas you start someone on, say, outpatient 1 or 2 days a week, if someone's in a psychosis, that's not going to help them at all. But if you put them in inpatient treatment, that's going to help them because they can get on the medication that they need. And insurance companies were denying that because they wanted a lower intensity of care. Now they can't do that. Now it's required that they have to start where they need to start. I have to say that I'm proud to be part of Illinois right now, because the committee that I sat on, the task force, and all the recommendations that were made went to the directors of the government agencies and then to the governor, and they passed. We didn't have them kicked out for any reason. So obviously the communication and the data that supported it was there, and we're going to see a big change, hopefully.
Right, I'm really glad that we did ask that you be on that board and be a representative for us, and it is great to hear occasionally, you hear through the news that Governor Romer has gone ahead and supported all these issues that are so important to so many people, especially people right here in this room, because we talk about it all the time, and then our health department and you yourself, because you guys work on it every day, and it's very important, and to see these strides forward is great. So it's great that the governor has supported that.
Exactly.
Yeah, thank
exactly.
you.
And then Senate Bill 336, which is probably a little more controversial, but it's the Opioids Act. It added that those who might otherwise seek opioids for pain management can now seek medical marijuana. Pain management was not one of the illnesses that was on the list of the registry in order to get it. That's now changed, and you can now get medical marijuana for pain. What is significant is that the Illinois Department of Public Health reported that opioid deaths increased 13% between 2016 and 2017. I want to say that ours increased 40%, so we're in a crisis zone. But the Journal of the American Medical Association reported that states with medical marijuana dispensaries saw a 14.4% decrease in overdoses. So it's an important treatment modality for people with pain. And as I said, pain medication is the pathway to heroin and to fentanyl. So it's significant that we now have an alternative. And I want to remind people that marijuana that's for medical treatment does not have THC in it. THC is the product that makes people high. So just so everybody's clear on that.
All right, thanks for pointing that out, because that is something that you forget about. You forget about the difference in that. Thank you.
Absolutely.
Did you just skip over to 77?
Yes, thank you. Sorry. Senate Bill 277 amends the Illinois Controlled Substance Act. And this, again, this is another tool to educate physicians about opioids. And it requires medical professionals to take 3 hours of existing continuing education on how to safely prescribe opioid medications. Those groups impacted by this have separate controlled substance licenses. That includes physicians, podiatric physicians, advanced practice registered nurses, physician assistants, dentists, clinical psychologists, optometrists, and veterinarians. That is so key, because part of it is getting people re-educated, and for some reason, even though people know it, you have to legislate it in order for them to require it. People want to keep their DEA license, so they're going to be able to do this, and this is going to go a long way. We know that in medical school, previously, you didn't get any information about addiction. And now that those medical schools have changed, but also now those folks who are already in practice will have to take some education also. So. Did I? Yeah. No. Okay. Let's see. Okay. So those are all of the legislative bills. You can see it's been an active session, and we're really pleased about all this activity. The other one that we're working with Stepping Stones is the waiver for more than 15 beds is still out there, and I've talked to Stepping Stones, and they are going to be expanding and moving their administrative staff to a different building. So that's going to open up opportunities for them to add beds to their Medicaid beds, and they're going to ask for to be included in that waiver that they can have more beds than 15. So I'm really happy about that. Also, as far as Stepping Stones, I was able to negotiate a $50,000 grant for them to have a recovery coach. And they're going to have it for this year and next year, so it's a little over $50,000. The recovery coach will follow people once their treatment has gone down to outpatient. They will be helping people get jobs, get housing, get all the things that they need to do. So we're really pleased about that. The other thing I wanted to let all of you know is that the DFC grants, which are grants for coalitions to be funded to do work in the community. those grants help us educate our youth and our communities. And we've had a couple of active coalitions that were not funded yet by the state. So I'm pleased to say that the Sheriff's Coalition was funded it's a 5-year grant. Each year you have to re-up, but their coalition now is funded, and that's the Will County Substance Abuse Prevention Coalition. Also Braidwood, the Braidwood Area Health Community Coalition got funded too. And they were operating but weren't funded yet. Wilmington has a coalition. They don't get funded under the new coalitions, but they're continuing to operate also. And I just want to point out that New Lenox has a situation where it's not a coalition, a DFC coalition, but rather it's a Safe Communities Coalition. And they're the ones who organized the event last week that was so successful. So, let's see. I think that's about it. So I've put information in here, just some of it's just for your information, so that you know what I'm doing, why I do what I do, and if someone asks you a question, you can all answer that question. So, are there any questions for me?
You're very, very thorough. I'm glad you gave us the real good list of everything, so that we have that as talking points for ourselves. So that's really great.
Well, I also think it helps our legislative agenda too, because
it does. It puts it forward. I know that I received something from our lobbyists, which is pretty much in relation to this, and they mentioned that, this is from Julie Curry, so I thought I'd bring it up here, even though lobbyists are usually legislative, but it's appropriate for us. You know, the majority of the changes involving behavioral mental health took place early this year and were included in the budget approved by the General Assembly and signed by the governor in May and June. So that is really good that we know that, because sometimes you hear about things and it's like, well, were they funded? Just because legislation got passed doesn't mean much, you know. But so now we know that, it's really good. And she also mentioned that the AJ Wilhelmi with the Illinois Hospital Association, the Safety Net Hospital Association, Illinois Managed Care, negotiated new Medicaid reimbursement rates, which is really good. Additional fund for behavioral health services for Medicaid recipients, which is something
that's critical, because they pay them nothing. And
correct.
People don't want to do it because of that.
Right, and a lot of times that's the population that's lacking support, so it's good that that happened. And that was fully funded by the 2019 budget as well, so that was good. She also mentioned that the Department of Health Care and Family Services, Behavioral Health Transformation, focus on prevention and public health, which is the key, is obviously prevention. Pays for value and outcomes rather than just volume of services, which is, you know, you hear that a lot of times. It's all on how many
people you see.
Right. And that isn't it. It's what are you doing is much more important, which is, you know, helps with the families in our communities as well. And then the 2019 state budget preserves and restores critical funding for mental health and substance use treatment and supportive housing, which that is cool, because if you have treatment, sometimes you don't have house.
Right.
You know,
That's
you need
exactly
treatment
right.
sometimes, so that's a really good thing. So it's a preservation of 3% of a mental health Medicaid rate increase, so that way it's not going up. Extension of psychiatric, oh my God, psychiatric, right. Medicaid rate add-on payments, preventing a $27 million cut to mental health services, which was good, because you're always worried about that getting cut, and a lot of times those are the things that get cut in a budget, because somehow people don't think it's important when that's the baseline for pretty much everything, right? Right. The community thrives on a good health rate. Increase in substance use prevention and treatment programs, as you mentioned, and all that, so that's really good. Maintain funding for supportive housing, again, you said good. And a new GRF line item for opioid overdose data collection prevention of $1.65 million. So those are all really, really good things. And then, so she gave us this information as well that probably would go to legislative, but I thought it was important to have us discuss this here, so.
In regard to the hospitals too, that reminds me that they're looking for them to now report to the state when there's an overdose. And so I'm going to be on a webinar this week or next week about how they're going to make that happen. Because that's been another huge disconnect, that we don't know all that data, and that allows them to get away with not doing anything if no one knows the seriousness of the breadth of the problem.
Right, right. Debbie, you want to mention a couple
I
things?
have a question. One is a question. You know. Is I know that before they had the grant that Deputy Jers was training with our local law enforcement. Are you still working with him and training with our local law enforcement? And do those numbers that they do, is that included in your numbers?
Yes.
It is,
Yes.
okay.
I trained all the police departments in Will County, and I still, if they need reinforcements, I'll go back and I'll train them. As far as Jeff, that's who you're referring to.
Yeah.
Actually, Jeff does a pinch hit for me. If I'm not able to be at a training, he'll come in and do it because he trains all the other officers in the sheriff's department. We never forget our first responders, and in fact, the first responders, really, they've had to re-up on their naloxone, and we've had a change in vendor for that, so I've been communicating with them, so we're fine, everybody's fine.
And then I just want to point out, you mentioned Braidwood, the Braidwood Coalition. Braidwood Coalition got a grant from the White House, and the White House gave one of 738 communities nationwide. So, I mean, if you look at it, that's all 50 states, and they were one of the ones to get money. So I do want to reach out and say kudos to them. They've done a great job down in there. I personally go to a lot of their meetings. I help them staff events so they can raise money, and they're doing a great job.
You should be very proud because, and actually, our 10 grants were given out in Illinois, so we got 2 of them. So that speaks a lot to Will County. The Braidwood folks were the first people who had a safe passage program. They call it Change. They lead the way often in being progressive, and I work with them very closely because they help me quite a bit.
Yeah, they're just a great group of, it goes all the way from their, police chief, Nick Ficarello, who most of you know, the mayor.
The mayor is
most mayors want to hide their head and say, no, we don't have, I don't want to say I have a problem in my town, but this mayor is like out there and he's like, no, we have a problem, we need to address it, let's do so. And it's just an amazing group of, people down there.
That mayor and that police
Great
chief
stuff.
actively participate in our MAP behavioral health committee. So they're there all the time, which helps us tremendously get the police that perspective because we need everybody's brains on the problem.
Yeah, so I just want to give a kudos out to them because they've done a great job.
Well, thanks, Deb, for bringing that up. Laura, you had something?
Personally want to thank you. Not personally, but from the whole board. You have brought this subject to light. It's been a problem for over a decade, and I am very proud to be sitting on this committee with all of you, as well as what Will County has done. This is a huge issue, and as far as myself being a nurse, I've seen it for years. Thank God we're finally getting something done. Thank you again, Kathleen. You've done a phenomenal job.
Thank you. And I actually use the fact that I make a monthly report to this committee as one of the reasons we can successfully move an agenda along, because without the support of the board, we wouldn't be able to do the things we do. So I appreciate the time that you give me for a monthly update.
Yeah. Beth, go ahead.
Are there any more municipalities considering starting a safe passage program, or police departments, that it's kind of in the works? Because I think we have 5, right?
Right. We have Lockport, Romeoville, Romeoville's new, Lamont, Okina, Braidwood, and then we'll have the sheriff's office, which is huge because that's a huge group. There are others that have been waiting, but we didn't know if we had capacity. So I meet now every month. I have a safe passage meeting, and where we invite all of the police chiefs to the table. I know Joliet was interested, but they've had some change in their police chief, so I think that's going to be back on target too. But it's not a matter of people not being interested. There's 2 issues. How do we figure out the capacity issues for the police departments that are small? Who are they going to identify as someone to help make this happen when someone shows up? But now with family guidance, that's going to lessen the burden, and that's going to help. So we need to get that word out.
Okay, I'm glad, I'm glad you came, and that's why every month I have you on the agenda, because it's so important. We have media here that puts it in the papers, gets it out to the people, because I'm hoping that one parent or one friend reads something and learns something and saves somebody's life by something that we have on our agenda every month. So thank you, Kathleen.
Thank you.
Okay, now we're going to move on to this never-ending burning issue. Dean?
It's a very narrow subject today. It's not
I know,
general.
I just was using it as, you know,
I understand.
it's a burning ordinance, as a burning issue. Burning issue. It's burning, go for it.
Okay, so,
Good morning.
you know, after the discussion at executive, I prepared 3 different options with slightly different tweaks to try to address the concerns of the board.
Okay.
I would like to start actually with alternate 2, because alternate 2 is the closest to what the International Fire Code provides. And you'll see the changes that I made were to take out the word neighboring, so it's any structure, you know, would prohibit within 15 feet. But there are exceptions for 1 and 2 family dwellings and structures that are protected by automated sprinkler systems. I also added, because I think I sensed there was concern among the board members with regard to grills and being able to use them in the way our ordinance was drafted, the grills fell under the same provision as the other patio open flames. So there's a separate section that was added for open flame cooking devices with the same exceptions. Now, that being said, that would not deal with the concerns that were expressed with regard to gateway, because it accepts out single family and 2 family dwellings. But that is what is in the International Fire Code. So then, if we go to alternate 1, to address the concern with gateway, what I did was remove the 2 exceptions for the patio wood burning unit. But I left the exceptions in for the grill, so that it would just prohibit open patio units from being any closer than 15 feet. So you'd be required, and there would be no exception for single family homes or 2 family home dwellings. But I did leave in the term neighboring and also added or combustible. So, you know, it would only prohibit it from 15 feet from being a neighboring structure. So if it's your own home, you would be able to be within 15 feet unless it was combustible. So if it's a wood home, siding that's easily catches flame, that you would not be able to. If you have a brick home, you would not be governed by the 15 feet. Does that make sense?
What was the gateway comment? I'm sorry, I didn't follow that.
There was, this issue was initially raised because of the gateway subdivision where the homes are very close together. But they are in compliance with the 15 feet away. You know, I think that they can put their patio warmers and they still just barely make the 15 feet away. Am I correct? So that was one of the concerns.
And they could have, if my recollection is correct, done this within their association covenant,
Correct.
but they chose not to.
Right. The association does not want to regulate it.
Right, they don't want to regulate it, they want us to.
I have a question before you go further.
Sure.
And I know this question was asked, and I'm not sure if it was ever answered. Can we make this rule just for communities like Gateway?
No.
No. Okay.
That would
then I
be
don't
considered
remember.
arbitrary and capricious.
Okay.
So you have
Okay.
to do it on objective
Okay,
standards.
I just needed to get
Yep.
that out there. Okay, thank you.
Yeah. So then, alternative number 3, and again, I have the patio wood burning unit. It has to be 15 feet away, but I did remove the term neighboring. So it would not matter. If it's your own home, you'd have to be 15 feet away, or if it's a shed, or if it's a garage, or whatever the structure might be, it wouldn't matter if it's combustible or not combustible, you would have to have it 15 feet away. And then again, I added as I did with the other 2, I added the provision for the open flame cooking devices, which would only be required to be 10 feet away. But would accept out the single and 2 family homes.
Right, so the open flame cooking devices are the same on all 3.
Correct.
Discussion, anybody?
And I can tweak it in any way, you know, these are just some thoughts that I had, so if you have different thoughts, you know, let me know. We will try to accommodate whatever it is that you seek to do.
In your opinion, does alternative one best address gateway circumstance of the three that you've spoken to? Because you said that
Well, it would-
you tried to address gateway.
Well, I took it out because I don't know that I tried to address Gateway specifically, but the concern there was that those houses are so close together that the hazard is greater. Now, I believe our ordinance presently provides for 15 feet away, so this really does not change that either. The only thing that it does is add that it's not just 15 feet, well, I don't know, was it 15 feet away from, in Gateway, were they 15 feet away from their own structure?
I think they were, yeah, the 15 feet, I think that was the main concern, was they were so close, but they could possibly put it 15, but it
From
had to
both
be.
structures, though.
Right, but that's the problem, they're so close together, I don't know if they have enough room.
Right, so I think it
So-
does, because my recollection is they were 15 feet from the neighboring structure, and they did not have to be 15 feet from their own structure. So now you would have to be, under this, you would have to be 15 feet away from both structures,
And
or any structure, unless one of the structures was not combustible. So it's a neighboring or a combustible structure.
What do you think? What's your opinion?
Well, I mean, I think it sounded like proposal one was trying, wasn't it? It was.
I
that
was
the
trying, right.
closest to, I mean, we can't find utopia here, I don't think.
Well, there's going to
But
be
we can do our
differences.
best.
There's
yeah.
going to be, no matter what you pass, there are
Yeah.
going to be people who are going to be affected.
Yeah.
So this is going to affect more than Gateway, and it's going to be your decision as to whether you want to go there.
Okay, my opinion is, I think I'd like us to be able to take it back to our caucuses, have a discussion there, see what everybody feels, and then bring it up again next month to make any changes, because we have the time to have a lot of different conversation in a different setting and with the whole group, and really get a good feel for what people want.
Yeah, just, I mean, we'll enforce whatever you guys want, you just have to let us know.
Yeah.
You think it's proper.
Right, could you repeat that? I'm sorry.
He said, well, I mean, we.
Whatever we felt was proper.
Correct,
Yeah,
right.
exactly, you have to decide what you think is
Right.
best.
I will say that if you wanted to kind of research the issue of the safety of these different things, the International Fire Association has some very good information on their site. I spent some time looking at it, looking at the hazard of grills, propane grills versus charcoal grills and all of that. So you can get some very good information.
Thank you.
Thanks so much, you guys. Yeah, we'll go ahead and do that, and we'll put it back on for next month to make any changes that we choose an alternate, one of the alternates, and then if there's a change there. So, and we also have to, consider with the sheriff's department, make sure that it's an enforceable thing, because lots of times, governmental bodies pass laws that cannot be enforced. So it's like, okay, then what do you have?
And we're only, we're not available like they are so often,
Correct.
Go out there the next day. But at 2 o'clock in the morning, somebody decides to burn, yeah, we'll have to go back and do work.
Correct. And you don't know if it's been moved then, because usually I move mine around, depending, to get it out of my way while I'm not
Sure,
using it.
I move mine every night,
See?
Yeah.
Okay. All right, thank you for all the different issues for us to look at. Thank you very much.
Thanks.
Okay, next we are going to move on to other old business. Any other old business? I don't have any either. We have new business. I want you, Diane, to get up here. Rita? Good morning. Good morning. So our new business is awarding bid for nursing services for CNA, LPN, and RN at Sunny Hill Nursing Home.
That's correct. This is a first-year award for November 1st, 18 through October 31st of 2019. We do award to multiple vendors, as I listed on the spreadsheet. We start out with the lowest rates per category for each of them and work through. So when Sunnyvale has a need, they call the first vendor on the list. If they can't fill the need, then they go down to the next and continue through. We did have one vendor that we had to disqualify. Worldwide Travel Staffing did not sign the staffing agreement, and that was a requirement that we included in the bid. And that is a HR personnel policy that covers benefits for those staff through the vendor rather than Will County.
Right, right.
So because they didn't sign that, we had to disqualify them. AmeriCare Staffing did not provide the number of staff in each category, which was another requirement from Sunny Hill. So even though they didn't include it, Becky did make a phone call, verified with them the amount of staff that they have. So they've been placed on the bottom of the list, so they'd be called last.
Okay, well, that's good.
So we're talking agency here.
Right.
HS.
Right, so because we have so many staff, and
When
then
they
people
call
call
off.
off sick, or
They take vacation.
but somebody's on
Correct.
leave for something like that, then we always have to have agency, because it's really impossible to staff for all those situations. So we have agency that come on, and they're really pretty much transparent. They come in and you know, a lot of the people, of course, are the same that work again and again. So they're very familiar with the residents and the processes we have at Sunny Hill, so, all right.
And it's generally only CNAs and LPNs, they call very few RNs.
And that's standard.
Okay, thank you. Do I have a motion to approve? Moved by Dallender, second by Rice. All in favor?
Aye.
All right, thank you. Okay, any other new business? Talked about a lot of business today. Mr. Brooks, thank you for joining us there. Kind of incognito. I would like to move on to public comment. Do we have some public comment? We have Mr. Control here with us today from the Sheriff's Department. How are you?
Good morning.
Good morning.
I just wanted to clarify something that was stated at the June meeting around the Historic Narcan training. I guess there was a Will Be Well training that was not attended by most of our employees. As you know, Will Be Well is to sometimes get points so that you get the card, so that means that you can attend any class, whether it's Weight Watchers, not smoking, or whatever. But I just want you to know that all of our employees at the Sheriff's Department are trained in Narcan, 650 of them. When they're hired, and every 2 years we train them in Narcan. We also have our Narcan kits in all of our AEDs, whether they're at the courthouse, whether they're at our ADF, or whether they're at our public safety building, in case we need to use that. Sheriff Kelly apologizes. He wanted to come speak to you directly, but today he has an arbitration with the MAP union. We did receive the DFC grant, as Dr. Burke said. He's been at the forefront with this. We did an on-site trailer with that, with the Vivitrol program at the ADF, which we have to sometimes spend a little bit of money overtime, but we believe that getting somebody back on the street, not committing more crimes, and keeping them out of our jail makes up for that. So, also with the Narcan, Sheriff's Department pays for that out of the federal seizure money. When we take money off the drug units given to us through the court system, that Narcan expires every 2 years. So there is a cost of about $75 per kit, and we issue over 200 of those kits to our patrol officers, so that money doesn't get out.
Yeah, it sure does, right? Especially with the two-year expiration date on it. And then I know you guys are using the expired ones for our dogs, for our dogs and training, right?
In dogs and training, right?
Okay, Kathleen, you had something?
I have a question. The Narcan kits, you said they're in all the AEDs that are in the public buildings?
I believe they're in the areas where the public is not. So that'd be in, I believe we have one in the courthouse. We asked for them specifically, but in our booking area, where all of our officers are trained, those AED kits are in there for sure.
Okay. downstairs, I did leave them with Narcan, so I don't know if you want to, those are your guys, so.
They're all trained when they go through CPR training every 2 years, even our CSOs.
So we want to make sure that everyone has the Narcan, because they're all trained to use it, so.
Okay, great, thank you for that update, thank you very much. Okay, Chairman's report announcements, I have none. Executive session, we do not have one. I have a motion to adjourn. Moved by Ferry, second by Gould, all in favor? Aye. We are adjourned until next month, October 4th. Thank you for coming today.